Hi, my name is Andrew Cirillo, and this is a video for wound dressing after a surgery. So the wound dressing for the surgery will be a general appendectomy surgery. So in this case, the pillow is going to represent the patient. These strips right here are to simulate the steri strips that would be applied over the wound after the surgery. So this would be after you have already removed the first layer of dressing, which probably consisted of gauze or sometimes packing first, and then gauze, and then some type of adhesive over that. So in this case, I've done a lot of research, and the general aftercare for an appendectomy surgery is really just you're either going to have staples usually, or strips. So if they're staples, obviously the doctor will remove those in usually like about 7 to 10 days or so. With the strips, those are supposed to just naturally come off, so it's not something that you want to take off yourself while you're dressing the wounds. If there is some that are loose or have come off already, it is okay to remove those, it says. But in this case, you are down to these bare strips now. It is okay to flush this area with just clean, plain water. After that, you'll want to pat it dry with, something clean and sterile. And then after that, you're ready to cover this wound back up again. It's been rinsed, it's been pat dry. Now you would use something like a piece of gauze at this point. There's no more oozing, there's no more major drainage, so a piece of gauze is gonna go right over here. In this case, it would be like just a little 2-inch piece of gauze to go over there. And then over the gauze, we're going to be using something like a square bandage like this that will have adhesive around the end of it to go over that to hold the gauze in place. So here we go. We have the 2-inch gauze pad, and then we have the 3-inch by 4-inch adhesive bandage to go over to hold it on. So this will go over the wound to help keep it clean and provide a little bit of padded comfort. And then the adhesive bandage will go over. It will hold the gauze in place and also provide support, so that if you have clothing or anything that's going to be riding up above this, usually we're kind of close to where your waistline would be, the gauze and everything will be supported, and the wound will be completely covered. And because of the multiple layers, there's a little bit of padding there for comfort, as the wound will probably be sensitive.